Hello B, hi Tess, how are you?
I'd be fine. How are you both?
Good afternoon. Good afternoon, folks.
Hi.
Um,
I saw there was a certain number of folks in the waiting room, but I didn't let anyone in yet in case there was any like
Yeah,
post session to happen first.
no, yeah, thank you Tess.
I think it's all good.
Mm-hmm.
Uh, Vincent, please, can you make Andrew co-host as well? Just so if it's possible, he can. Rec can you record a side session, a breakout
I think
room?
you
Is that
can. I think you can. Yeah.
You can, yeah, you can, but you have to record it locally. So I can make Andrew, I can make Tess, are you co-host?
I was when I joined it, but it looks like it's
Okay,
jumped to both of you now. Now I
okay,
am.
I made you
I'm gonna
co-host.
have to jump off about 5 minutes early
Okay,
though at the end. I'm leading another workshop after this, so I'm not sure that I'm able to do it. I'm afraid.
yes, of course, I will make also, I will admit, oops, making a mistake here. Just forgive me, I will
no, take your
remove.
time, please.
I think Edgar Onyango is not Eric Onyango,
No, I
obviously.
know, I know. I had the same. I've had the same situation. So yeah,
I
yeah.
saw him before too, yeah.
But so there is a way to record locally, not on the cloud, the breakout room. Yeah.
Okay.
Like onto the computer, I think, right?
Exactly. That's correct.
Okay, I don't
So
see Andrew though, and I don't know if he said he
yeah.
wasn't coming.
Uh,
I'll check in with him and see. But um, let me send
oh,
him.
he's here. He's here.
Okay. Oh, okay, excellent, excellent. So he's co-host now.
Yeah, he has co-host Andrew. Hi, you have co-host permission, so you should be able to record your breakout group discussion locally, at least, hopefully.
Excellent.
All right. So I'll move in the interpretation room if that's okay.
Yes, yes, of course.
And
Thank you.
so see you guys later.
Sure,
Bye.
sure. Let me pull this up and everyone can see.
Thank you, everyone.
Hey,
Good
Gerardo.
morning.
Make sure, and I'll let people in. If this thing will just let me. Oh, okay. Okay. Excellent.
Good afternoon.
Good afternoon. Good afternoon. Good evening. Good morning, everybody.
Yes.
Thank you all for joining us. We will we would like to ask everyone to please introduce yourselves as we have very limited time. Please use the chat box to introduce yourselves so that we get to know who is on this gathering for the discussion on domestic resource mobilization. Please tell us your name, your organization, and the country that you're from. This would be really helpful so that we can get a better sense of who's here and the breadth and depth of the participation. So again, please use the chat box to introduce yourselves. I will start off and feel free to add yours. Thank you so much. We will wait 1 more minute to make sure everyone has joined and before we jump into the process. Thank you.
Can I start?
Hi. Yes. So we are doing the introduction on the chat box, just the chat, because it's just of the challenges with the time.
All right.
Yeah.
All right. All right. All right.
Someone is raising their hand. Staff Amami.
Oui, bonjour tout le monde.
Bonjour.
Good morning. Je suis Dr Moulay. Je suis le président de l'ONG Amami de la Mauritanie. Mais s'il vous plaît, on a besoin d'une traduction pour vous accompagner. Merci beaucoup.
Merci beaucoup, docteur.
Hello, do you get me?
Yes. So please use the chat box to introduce yourselves. Please tell us in the chat box, use your name, your organization and the country, please.
Okay.
Thank you.
All right, I'm trying to do that. It is
Thank
Ben
you.
from Liberia.
Can I introduce myself?
Yes, please use the chat box to introduce yourself. I think one of the way we are using this as a way to help us to move along really quickly for the introduction.
Yes. My name is Abdul Haq from Youth Association for Development, Yad, Pakistan.
Thank you very much, Abdullah.
Yes.
Okay. I think we're going to start. If I can please ask everyone to turn your video off, not because we don't want to see your face, but because a few of our partners here are connecting with challenging internet connection. So when we use video, it's hard for them to be able to follow because video increases the bandwidth for them. So and they have limited bandwidth. So thank you all. I really appreciate it. Please use the chat box to introduce yourselves. Tell us in the chat box. Tell us your name, your organization, and your country. Okay. With that said, I'm going to start the presentation. Please continue to thank you very much, Vincent. For folks who are joining who have a preference for Francophone, please connect to the Francophone translation process. It is at the bottom of your Zoom screen. When you select it, it will give you the option for interpretation, and in there you can select French. And in there you will have my colleague, Vincent Villeneuve, who will be conducting the translation simultaneously as I am talking.
And maybe if Guillaume or Tess could also just translate that into French really quick.
Yes, please.
Yeah, I think Vincent wrote it earlier, but I'll write it again.
Yeah, he did. But just in case it got lost in the process of introduction. Great. All right, so I'm going to share my screen and then we can start with the presentation. Good morning, good afternoon, good evening, and for some people, it's probably late at night. Good night. Thank you for joining us. My name is Adebi Adesina.
Bonjour.
I am the Director of Health Financing and Health System Strengthening at PAI. I have the pleasure of facilitating this session on domestic resource mobilization with a focus on SRM CH+N, the core interventions that are funded through the Global Financing Facility, the GFF. We are going to go through the process of the this quick presentation. The agenda for today is the introduction, which we've done, the chat box, and then we're going to have a really quick discussion about the Global Financing Facility, the GFF, and then we'll jump into the core of our conversation today on domestic resource mobilization and all the key aspects and processes around it. We will also focus on how civil society can gain entry points for both advocacy and accountability for the process of resource mobilization. And then we will, once we're done with talking about the key technical pieces of it, we will have a Q&A sessions where we can answer key questions that people are having. And then once we've concluded that, we'll have a small group discussion around some of the workshop questions that we shared with you, and or anything that is prominent and or key for you. And lastly, we'll share our perspectives from that discussion and then wrap up. So I'm going to go into this next piece on the GFF. For those of you who have been part of the GFF for a long time, and or for those who have participated in the workshops that we had on investment case for the GFF, you are familiar with this slide. Essentially, to give those who have not had that chance a little bit of a background, the Global Financing Facility, as we call it, GFF, was established in 2015. The goal of it was to provide funding and or technical support for sexual, reproductive, maternal, neonatal, child, adolescent health and nutrition, SRMNCAH plus N initiatives in currently 36 plus countries through providing technical assistance for health policy and or health financing strategies, and or providing direct grants and loans to fund those initiatives. The other part of this is that as part of the agreement, a country's agreement with GFF, it will have a co-financing strategy on domestic resource mobilization. In other words, the country will put in part of its own fund to work together with the funding from the GFF in order to ensure that it improves impact and efficiency. And in part of improving both efficiency and impact, it has to be coordinated within the country's health sector plan and or SRMNCAH plus N specific plan. And that means that it has to be in accordance with everything that the health sector, the public health sector, the full government health sector plan. It follows that plan. And that means also engaging with the primary healthcare delivery system and coordinating to ensure that it is not its own separate process of delivery that is within the primary healthcare delivery system. So now we're going to talk about domestic resource mobilization, and I'll start using the abbreviation DRM within the government financing process. I'm going to start with a few terms, introducing you to a few terms to help you understand the totality of how DRM operates within government policy and government implementation of resources. That's important because for quite a few of our partners, they've worked with ministries of finance or ministries of treasury or economy, and a lot of those ministries and their staff, they think about health. They think about health not just as domestic resource mobilization, but within these other key terms. And we're going to learn about them and how they work. And I'm going to focus just on a few of those terms, and so that we can get a better understanding of how they fit, and to help you better understand the language of those who manage a country or regions finance and economy. So We are going to learn about DRM, which we know the word, but we're going to also discuss all these key terms. So first, let's clarify what DRM is. DRM is the process through which countries raise funding, allocate those funding, spend down those fundings to finance public services like health or education. So in short, it's how countries put money together and then allocate it, spend it to fulfill the objective of their health or education policy as examples. It involves how government manages finances, otherwise known as public finance management, to generate resources, which is called fiscal space, to achieve their commitments to citizens, which means meeting their social policy objectives while maintaining a vibrant economy, which is how they use their fiscal policy. Let me jump a little bit more into the detail about it. Public finance management is the management of government finances, from everything from how government collects money to how it spends that money. So it's not, there are a number of key steps in that process, and it involves a number of key actors and ministries and political decision makers. So it's important to understand that it's not just money in, money out. There are a number of parts to it, and we'll discuss that in more detail. Fiscal space is that resource pool or that envelope of spending that is available, that is available to be able to achieve government's policy objectives. It's simply just what funding pool or funding envelope is available to achieve government's objectives. Social policy is the way the government tells you they are going to meet the needs of their citizens through providing public goods and services. So they are saying there, for example, that they're going to reduce maternal mortality or improve health generally, increase employment, free education, increase nutrition. Those are social policies, and the government will have one or more plans in order to be able to achieve those outcomes. That is what they call social policy. Last but not the least is the fiscal policy. The fiscal policy essentially guides the government on how to use all the instruments of resource collection, that's taxation, and public borrowing, and to influence the economy and improve lives. Essentially, it's how the government balances its objectives, social policy, and all other financial responsibilities, and manages that to ensure that its economy remains viable. That's what fiscal policy means. It's a guiding set of plans, strategies, activities to continue to maintain the health of the economy. Okay. I'm not sure who this. I think somebody's mistakenly using their pointer here. Let me see. Excuse me 1 second. Let me just be sure that we have a way of addressing this issue. Let me quickly check here.
You should be able to delete it
Yeah.
there's like a eraser up top,
Okay. Thanks.
or it's like a clear all option under annotate, I think.
Here we go. I can't seem to find the annotate. No, that's not it. There we go. Okay. Thank you very much, Tess. All right, so I want to talk about the concept of these terms that we just learned so that we can understand it. So you have the government's, if you, as a government, you have the situation of balancing both your social policies, that is how you meet the needs of your citizens through providing public goods and/or services. And you have your fiscal policy, which is balancing how or maintaining your economy, your country's economy. Those two work hand in hand together to ensure that both your people and your economy are growing well. But how do you do that? The how involves using domestic resource mobilization and public finance management. They are the means of implementation. They help you set policy. They help you implement policy and guide that you're meeting your policy objectives. So when you have resources that need to be spent, you need those resources coming from being managed by your fiscal policy, but also being used by your social policy to achieve your wider objectives. And so DRM and PFM are the means by which you're able to do that. So in order to implement, in other words, to implement fiscal policy and social policies, government needs to be able to implement DRM and PFM to help guide, one, how the revenue is generated. In other words, the resources that the government can spend to meet its objectives. How those funds will be allocated. In other words, are they spending for health? Are they spending for education? Where are they going to be spending it? When and who and where those funds will be disbursed, when they will be released. It means that, is it going to be annually, quarterly? Is it going to be going to local government? Is it going to your Ministry of Health? And then what the funds will be spent on means, will the funds cover medicines and commodities, salaries for health providers, supply chain overall? That process of the revenue generation, the allocation, disbursement, and expenditure is what we call our fiscal space. And so by describing all of this, I wanted to share that the entire process of domestic resource mobilization isn't just collecting money from by the government and then spending it for health or for education, for whatever social policy. It involves a number of key steps that require understanding how those key steps and processes work. And that is why we're thinking about it within this general concept. So I'm going to move on from a quick discussion around DRM and government financing to focus on DRM for health financing, because DRM exists as a government-wide approach, but we want to use it in the context as it relates to health financing, and with focusing on the example for SRM and CAH. So one of the key points about creating a DRM strategy, how you're going to implement your domestic resource mobilization, requires some key questions. The first question is, which sources will the government use to generate income to finance this agreement? So how will the government generate the financing that it needs? Will it come from taxes? That's tax on income, on sales, when you're doing purchases, what people have heard called VAT, value-added tax. Will it be luxury goods for specific taxes on luxury, whatever the way it comes, whatever tax process it comes from? The other opportunity is through specific goods, whether it's, in this case, when we're thinking about health, it could be those unhealthy goods like tobacco, alcohol, and sugar products. Would it be taxing those particular products? Will it be including the taxes from natural resources like timber, oil, cocoa, minerals, and so on, and metal that your country uses as a natural resource. Will part of that funding come from bilateral or donors? Would it include loans? And speaking of loans, will the government borrow from the capital market, that is the private sector market banking system, whether internal or external? Or will the government issue bonds? For those who might not be familiar, governments issue bonds, which are essentially like a share in the government or stock in the government for those who are in the stock market. Basically, the government will say, I will sell you a piece of my future earnings. You buy them now and you will make more money in 5, 10 years or something like that. So you borrow me money, I'll use that money to invest and I'll make money. And in 5 or 10 years, I'll give you some of that investment in addition to the money that you shared with me. So that's the process of government issuing bonds. So those are different resources, and these are not meant to be exhaustive examples. They're just the most common examples that we can use. And the basis of this is to just get a foundational understanding of this process. So in addition to identifying resources and the source of those resources, it's also important that in your domestic resource mobilization strategy is equitable and efficient in generating revenue and in investing those revenues. And that's a key piece of the process. As I said earlier, there's often a confusion that it's simply that DRM is simply about collecting money and the government will immediately spend that on whatever the issue that it's been collected for. That's not necessarily the case. It's important to understand that DRM stretches from that revenue collection process to the process of actually spending it, so how it gets spent, and so on and so forth. So that efficiency means and effectiveness means that your taxing process should not weigh heavily on the poor. And by that, I mean that we know that across a number of communities and countries, the people who are poorest often have to pay a lot of money out of pocket to be able to access health. So if a government were to say, okay, we're not going to, you're not going to pay out of pocket for health services again, because we are going to make it free and available to it. But that government goes round and then starts taxing people such that the tax burden or the effect of the tax is equally heavy on the poorest, then that is not an equitable process. So saying that you don't have to pay out of money, but then you have to pay taxes, having the same effect. So that's why you have to consider the equity of the process of collecting that tax. The other thing is that the tax collection process or the gathering of the resources needs to be consistent and fair and cost effective. By that, I mean that it has to be, in order for the resource generation to be sustainable, that is, that as the money is coming in, people are able to know and assure that money is going to be coming in, and money is coming in consistently. That helps them plan for the future. That ensures sustainability, for that that resources are coming in to fund those key health activities. So you need the collection to be consistent and fair, and it has to be cost effective. In other words, that the process of collecting those taxes does not cost you more than the actual money that you're getting from the taxes. Because to that end, then you don't have resources. By the time you spent it all on collection, then you're not able to use it for anything else. The other key question that you have to consider on that, it's the efficiency. How are those revenues invested in the public health sector? How much of them? Because you might think, okay, say taxes for tobacco, for alcohol and sugar products, they have health impact, so they should only be spent on health. That might not be the case. It might be that part of that funding goes to health, part of that goes to education, or part of that goes to commerce, to look for different ways of generating income rather than through these particular products. So, excuse me. So it will be important to understand how much of those revenue actually come to the public health sector. Another key part of this is aligning different co-financing agreements. The reason I say this is that as resources are coming into for health, it's important to understand how many external or internal partners have an agreement with the government that they will co-financing. Because if you have a co-financing agreement with GFF, you have a co-financing agreement with USAID, you have a co-financing agreement with UNFPA, and all of them require that you provide a certain amount of money in order for you to be able to get those fundings from those the three different sources. You don't want to overburden your source of your streams of revenue, such that you promise you said you promise half of your resource to USAID, half of your resource to UNFPA, half of your resource to GFF. That's 3 halves. That's more than you have. So you're spending everything on those 3. You have to be able to understand and work to better align that you're not overusing or overspending the limited resources that you're mobilizing. So it's important to understand what are those commitments to different key partners in this process. So I'm going to move on to that discussion around how the government does the co-financing agreement. And this is a topic that has been of great interest to multiple partners, because they are trying to get better understanding and insight into what it takes to receive GFF funds in particular, but other funds are other partnerships might also equally require co-financing. So it's basically the co-financing agreement is that if you get external funding from a donor or from a partner, external partner, you are required to bring your own money. So that's essentially a co-financing agreement. The question, of course, is where are you going to get your part of the money as a government to put into this shared agreement? So key questions that you have to think about in this process are, how much exactly is the part that the government agrees to of this total funding? How much is the government going to put down as part of this government total co-financing agreement? And then when and how are those resources going to be disbursed? That's how you are going to be spending those resources. So under what the government share is, you need to know if the government share, for example, is going to stay the same. That is, it'll be half of the co-financing agreement for the life of that project, or if it's going to be incremental. In other words, your government has a co-financing agreement with, using the example GFF here, and they say they're going to start for this first phase of their agreement, government will bring 1/3, 33% down. And then the GFF will put 66, 67% down. But when the next round of funding comes after 3 or 5 years, now government will bring 67% down and GFF will bring 33% down. So that's a way of understanding how, if there's an increment, a gradual change in the funding share. So that's important to understand. It might be within a funding cycle, it might be between 2 funding cycles, but important to ask how much of it will be. Another key question is, will it include private sector providers? In other words, And if so, how would that work? In other words, say, for example, there are private sector providers who offer SRM and CH plus N services. And the government puts, and part of the requirement and that co-financing agreement is that those private sector providers can be part of the system. They just have to provide the services, and they go back to that funding agreement to be able to get reimbursed. So a key question to ask is, are private sectors providers included in this process? The third part is, are there conditional requirements to the co-financing agreements? In other words, is part of the co-financing agreement including a condition that has an impact on economic outcomes? Well, an example is the Global Fund's debt to health mechanism, which basically means the Global Fund goes into an agreement with the creditor for a government, the person who owns the money, who has the credit where the government borrowed from, and they arrange a deal such that the creditor writes off that debt from the government, but the government has to pay that debt by investing it into health. So instead of paying that creditor back, the agreement that Global Fund makes is that the government uses that money to pay for their health co-financing agreements. So these are just a few questions, again, not to be exhaustive, but to give you some thinking points around these key questions about how the government assesses its share and what the conditions are. When you're thinking about disbursement and spending, there are quite a few issues to think about. Is it conditional on spending? Is the spending to achieve a certain targets before external funds come? So you might have a situation where you have the co-financing agreement is what they call a results-based financing agreement, so that government pays all the upfront costs. That's the training, the medical commodities and contraception and medicines and things like that upfront, and that as they are meeting their targets every year, the external funding, or to give an example, GFF funding now says for every person that you reach for immunization, every person that you reach for antenatal care, every person that you reach for family planning, we will pay you X amount. So that's a conditional on the results that the government is achieving, but the government has to put money in the very beginning. Another key condition on how the money is dispersed and spent is on the restrictions that might be on what the government can use those funds for. It might be that those external funds can only be for paying medicines, but the government's part of or share of the government of the co-financing agreement will pay for staff salaries. So also an important area to assess. So these are just, again, very basic questions to get a foundational understanding around what the conditions, the stipulations around the co-financing agreement. And not just with GFF, we have a number of partners who have co-financing agreements with the governments. So when we now need to think about that spending and that use and spending of those resources for health, and that means that you have to think about its efficiency, effectiveness, and flexibility. You want the resources to be available so that you can predict and easily implement programs and services, activities related to programs and services. So you want to be able to rely on those resources that will be in place. That means that you have to use those resources efficiently and effectively to continue to show the need. And it's important to think about these key issues. So one of the things about developing an advocacy plan or strategy for resource mobilization is that when you start focusing on those very narrow program areas, like you will immunize children under the age of 5, you will provide pediatric ART, and so on and so forth, then you are only creating very narrow targets and goals, objectives. What happens when you achieve those goals and that same population has other needs? So you are trying to immunize children under the age of 5, and that's your goal, and you achieve that, but those children also need proper nutrition. Those children also need care beyond the age of 5. So what happens is when you focus on only those narrow goals, then it becomes a challenge to reset your resource pool, your DRM strategy, your fiscal space, because that means going back and changing policy. When you change that, you have to change policy to say, oh, now we're focusing not just on immunization, we're focusing on children's health. Now that means you have to change policy conversations and strategies. You have to change legal and budget strategies and dictates. So it requires a lot of effort to go back and change. So you have to think strategically about what is your long-term objective. And you have to merge that into how your resource mobilization strategy is able to advocate for increased resource investments. The other thing is that in order to be effective and efficient, that means in order for the resources that you have, however limited they are, to be able to go far and do more, you have to think about how it is integrated with the way health is delivered in your country, because you don't want to create that service delivery process to be separate. You don't want a situation where they're only, as they call them, mother centers, or they're only clinics for children under the age of 5. That means that you're building or you're only using clinics that are for a small population when you can use that clinic for multiple other objectives. So you have to think about how service delivery, that is the tail end of the work of where the resources get used, are integrated with all the other ways that services and programs are delivered. And that means you have to think about the primary healthcare system and its process of integrating service delivery. So that's a key way of ensuring that those resources, that financing is easy, effective, and is efficient within the health system delivery process. The other thing that that I want to mention, pardon me, about this is that the financing is meant to support the delivery of programs and services. And so it's important to also think about who gets to make that, where that money it goes. In other words, people think, oh, in my country, any health resources that come for SRM-NCH must go directly to the Ministry of Health. That might not be always the case, because the situation is that the funding, the Ministry of Health may not be the immediate provider of care. In other words, the Ministry of Health may not be the one that has all the hospitals. It might be the case in many countries, but not in all countries. So you want those resources to go into a place into a process that allows those resources are easily available to the places where services are delivered, and not just to a bureaucratic agency. So you have to be sure that those resources are well channeled to how they are being translated into, invested into actual service and program delivery. The other part of this is the alignment with health financing strategies and agreements. So it's very important that you consider your country's holistic health financing strategies. Some countries have what they call universal health coverage, which means that there is a financing mechanism in place to ensure that people are able to receive services without having to pay out of pocket. So the country has pooled together money. They've created an envelope that says, okay, anybody goes into a facility, they don't have to pay. That payment for those services comes from this funding basket that we have. When you have a co-financing agreement, does that co-financing agreement, is that kept in a different basket, or is it kept within that basket to make sure that it works together with your UHC basket? That's going to be important, because when you start separating your pools of resources and you're saying it's only for SRM&CH, no, it's only for HIV, it's only for this, then you are creating different pathways and you are forcing health system service delivery to separate itself instead of being integrated. So it is important that the financing strategies are coordinated, because that will help encourage coordination of service delivery, coordination and integration of service delivery, because we know that the coordinating of those service delivery, it creates similar or great impact at lower cost. So it's very cost effective. Lastly, and most important, and this is where we're going to jump into that our discussion on accountability and advocacy entry points. You have to monitor the fiscal space. So monitor how resources are generated, monitor how they're dispersed, monitor how they are spent, because that's going to help you ensure accountability, that the money that civil society members have been part in advocating and that government has committed is actually spent for those things that it was committed to do. So that requires active monitoring. So I'm going to talk here about how you do that advocacy and accountability entry points. We're going to first think about that fiscal space that we first talked about. The revenue generation, where the money is coming from, taxes, donor funds, loans, and all the other places where resources can possibly come from. How they're allocated, are they going to be apportioned to? They said, okay, all the resources that are coming in, they're going to be spent for SRM&CH. They're going to be spent for, they can't include non-communicable diseases and things like that specify where money is going to go. Then how that money gets released, the disbursement, is another piece of question that you have to think about. Is it going to be done annually, quarterly? Is it going to go to local governments? Is it going to go to Ministry of Health? Is it going to go to State Ministry of Health, so on and so forth? Lastly, it's going to be, is it going to specify how that money can be spent on those programs and services? Is it only going to be spent on medicines and commodities? Will it include salaries for health providers? Will it include salaries for program non-health staff? Would it be essentially for supply chain? Where can that money be spent exactly? So that's going to be important. So we have to think about all these elements as we think about fiscal space. So in the next couple of slides, we're going to talk a little bit about all these different stages of the fiscal space and how civil society is able to both understand it and continue to conduct effective advocacy and accountability through those processes. So let's start out with the revenue generation part, which and many of you who were part of the investment case are familiar with this this strategy, this approach. You see that we've divided into what key actions we're focused on, where sources of information will come from, who the key actors and what forums you're able to engage those actors, and some of the important questions that you want to ask in order to be able to maintain civil society, your civil society organization's ability to advocate and hold government accountable. So for revenue generation, when we're thinking of the key pieces of that, we're looking at those funding streams, those your taxes, your natural resources. Where is the money coming from? The second part of it is, in order to be able to even start negotiating for having increased resource mobilization or resource spent, you also have to have a plan, because nobody's going to give you money just to say, oh, we need to reduce maternal mortality. They will want to know, what is your budget? That budget has to come from a plan, because that plan needs to show what you intend to do, how it intends to reduce maternal or maternal mortality and morbidity, infant mortality, so on and so forth, and how much money it will take. So that's going to be your sort of starting point for being able to negotiate for increased domestic government resources investment. You also have to think about all the different players and whether there's an agreement across them. That's an important factor that we don't often appreciate. I, coming from health financing, granted an academic training, was not aware that there, you had to be sure that there was a memorandum of understanding between Ministry of Finance and Ministry of Health, for example, because that you assume that government has to have a plan in place. That may not always be accurate. And so it's important to understand what is the policy, the government policy for how resources get, how resources are collected and how they are allocated and spent for those key objectives. So that means understanding what agreements exist between your different ministries. The other thing is there has to be an agreement between the government and those external funding resources. In this case, we're using GFF, right? There has to be an agreement on that specifies how much is going to come from external funding, how much is going to come from government, when it's going to be spent, all the elements of it. So that and a lot of those co-financing agreements are legally binding. So it's important to understand that what it entails to be in partnership in that, so that you can better understand how those resources are going to come in. Excuse me, I just want to really quickly sneeze. My apologies. Thank you. So the next part of that is, in order to be able to follow these key components, you have to be able to identify where that information is going to come, where your documents and data resources are going to be. That means you have to look to the ministries of internal revenue, where your revenue is collected and managed, your finance, who gets to decide how that money is apportioned, and then your ministries of health, who are the ones who are responsible for public sector programs. So you need to understand, that there's a health financing strategy, there's a health sector plan. That health sector plan includes SRM&CH plus N. It includes a budget for your health sector as well as your SRM&CH plus N initiatives. So you have to have all these key information in place in order for you to be able to identify how the revenue is going to be spent. You also have to have your documentation of the high-level agreements between your government and your multilateral development bank, like the GFF, the World Bank, the African Development Bank, the Asia Development Bank, the American Development Bank, things like that. You also have to have your MOUs, or at least policies that state this is what happens when resources come in for health. This is how it gets shared. This is who gets to receive it. so on and so forth, between the different key ministries and government agency. And that means that you have to engage with all the actors within those specific areas. Your national ministries of health, your what they it might be Ministry of Treasury or Ministry of Economy, budget and planning, your GFF country liaison or coordinator, your African Development Bank coordinator, and things like that, because you're thinking not just about GFF, but how those align with other different co-financing agreements. You also have to identify where can you engage with these people. Do they work together in a national working group? Do they have a planning strategy meetings? How they are all required to be transparent about how those conversations and agreements get made, and in order to do that, you need to know how and where they meet. So that means you have to know the forum in which you can engage with them. And when you're thinking about this revenue generation issue, you some of the possible advocacy and accountability questions that you can ask include, which government resources will fund health sector initiatives? Is it a combination of taxes, loans, government bonds? Where is that revenue stream coming from? And how much of that it actually gets arrives in that basket and per year? Because that will help you understand how much they can actually have to spend over the next year, because it's a requirement. It's part of a planning requirement for government to be able to predict, to have some level of economic forecast of their resources, the revenues that come in. You have to know what is the total physical space, how much exactly is available for health, your co-financing agreement for health and specifically for SRM-NCH. How much of that money in that basket can actively go to SRM-NCH plus N? You have to understand of the health sector budget or the SRM-NCH a nutrition budget that was created within those strategic plans. How much of that is the government's share? How much of that is the government's responsibility to deliver? And then equally important, how many people are they planning to reach? Because that's tied to your resource availability. The resources you have tells you what activities you can actually implement. And what activities you can implement tells you the number of people you can actively, or gives you an estimate of the number of people you can actively reach. So that leads all the way back to being able to understand the scope of what is being asked, what those resources are able to achieve. So the next part of this is the allocation. As I mentioned before, there are many moving pieces around domestic resource DRM strategy. It's not just collect money and then spend money. When government collects money in most countries, there is a requirement that political decision makers have the oversight on how that money gets used. So that means you have to have political representatives looking at and allocating those funds. That's often the case for a number of countries. And so when you're talking about allocation, you have to have first of all, what is your government's ministries and executive offices public finance management strategy that tells you how they have a plan for revenue generation, revenue allocation, and disbursement and spending. But equally important, you have to include in that what role does the legislator, and by your legislator we mean your parliament, your assembly, your senators, your representatives, how do they fit into that decision-making network? So they are going to be the ones who get to say how much is going to go to health or how much is going to go to SRM-NCH. So it'd be important to be able to engage with them, and to be able to understand what they're doing means looking at, the government budget, looking at the calendar for when the government is going to release its budget, for when it's going to give you either a preliminary budget or final budget, when they're going to hand that over to the legislature, to your parliament, to your assembly to review and to approve. That means looking at when your legislator is going to be, your legislative arm is going to have discussions and what their calendar looks like, and what the approval process looks like, and what sort of reports they're going to be generating while they're doing this approval process. So that means looking at schedules and committee notes and discussions and things like that. So obviously, at this point, your actors are not just your ministries, they include your legislature, they include your executive office, whether that's a prime minister or president's office, because the prime minister or president office, the executive office is responsible for gathering that, deciding that how all the budget across the different ministries and objectives that the government has is pulled together and submitted to your legislator. So you need to understand what the budget office for the executive is, or what the budget submission process involves for the executive office. And so to engage with those political decision makers, you need to know when they have information sharing days or committee discussion days, or when they have when your national technical working group is meant to present their work and things, present their budget and things like that, or review the budget. So that involves understanding all those key players and what their schedules and their processes, what roles they play, in other words. So as you're engaging these different key actors, you want to think about, when it comes to allocation, you want to think about, do they publish an annual pre-budget, for example? Is the executive or ministries, do they encourage public input into their budget development? Is the legislative process open for public or civil society input? How much of the actual health sector or SRMNCH budget does the legislature approve? Because once they get that budget from the executive to review, how much of what they see for health or SRMNCH gets approved? And or do they have the authority to amend that budget? In other words, do they have the authority to add or take out of it? That's going to be key, because that helps you tells you what your room for budgeting of the final resources that are approved will come to you. So that allocation process is going to be key to understand. So I put the disbursement and expenditure because they essentially work hand in hand together. So in the disbursement process, you need to know when government is scheduled to release those resources, when they are scheduled to send money to the agency that's responsible for using those resources for activities that support service delivery and program delivery. You also have to be able to understand what is the procurement process within your respective health delivery service. Procurement means how do these organizations, government organizations, find people who supply them what they need, or pay people who supply them what they need in order to implement those activities around service and program delivery. You also equally have to be monitoring the progress towards those health objectives or SRMNCH objectives. That means basically being able to compare, as the money being spent actually reaching the number of people that need it, or the number of people that are included in the objectives and targets set in that original health sector or SRMNCH plan. So you need to look for the government's disbursement and expenditure and procurement reports That's going to be key to help you to trail or track through that disbursement and spending process and what they're spending it on. You also need to have access to routine service delivery data, or at least some progress set of indicators that tell you how many people are being served by each program area, whether it's number of safe deliveries, facility deliveries, whether it's the number of immunizations, and so on and so forth that you are that fall within the area of SRM and CH. So you have your government actors, you have your non-government actors who are also implementing. So you have either it could be private sector or there could be non-governmental private sector, private for profit, private not for profit. So it's important. It is important to understand who are all the key service delivery points who are going to be receiving these funds and how they're going to be receiving these resources in order to provide this SRM and CH plus N. So you need to, part of some of the questions that you can ask is, are they releasing those funds on time? Because if, for example, you have to reach 100,000 people by the end of the year, but your funding was released in September, can you really reach 100,000 people in that time? And can you spend the money that was given to you in September before December? Is that a feasible timeline to be able to pay for all the activities and implement all those activities? Very key questions to ask. I think is the procurement including all those goods and services needed to provide SRM and CH plus N in activities? Are they done on time? Are they able to deliver the actual services in time? And are you reaching the number of people that you set out to reach? And if not, why not? So I went through this fairly quickly, but I wanted to be sure that we got some time to have Q&A. But I want to now pause at this point to talk about, we discussed all these key concepts, the DRM, the physical space for health, and those key stages. And we talked about the engagement points. Are there any questions around this process? Is there was there any point at which I went too fast, or there was key parts that you wanted to, you had a burning question about? Maybe we can use the next 10 minutes to address those questions. Please feel free to add your question to the chat box, or use the Zoom function to raise your hand, and I'll be happy to answer your questions. Let's see, let me quickly check to see who's asking questions.
We have a question from Amami.
Amami.
Merci beaucoup pour la pertinente présentation qu'on a vraiment suivie avec beaucoup d'attention. Dans votre pertinente présentation, vous m'entendez?
Oui.
Dans votre pertinente présentation, vous avez suggéré d'avoir une stratégie de financement. Cette stratégie doit être coordonnée pour augmenter l'impact de nos interventions. Malheureusement, dans nos pays, on souffre de problèmes d'un leadership capable de regrouper tous les intervenants et de faire qui fait quoi et quand et comment. Par exemple, dans le cadre de la nutrition est divisée entre deux ministères. Le ministère de la Santé, pour tout ce qui est CRENAS, la prise en charge de la malnutrition aiguë sévère avec complications, sans complications. Et il y a aussi le ministère des Affaires sociales qui prend en charge. Et donc, chacun des intervenants, ils interviennent séparément à l'autre. Donc, il n'y a pas de coordination. Donc, moi, je pense que vous, partenaires, vous par exemple, quand je parle de vous, par exemple, les GFF ou d'autres partenaires, vous avez un rôle crucial important de nous aider nos pays à formuler et à renforcer les stratégies de financement. Non seulement de nous donner de l'argent, mais un accompagnement technique pour vraiment recenser les ressources supplémentaires possibles de financement durable de la santé et aussi de nous aider dans le plaidoyer pour l'augmentation des budgets internes. Nos pays ne sont pas des pays très pauvres. On a besoin vraiment d'un accompagnement. Nous, société civile, moi je suis le président de l'ONG Amami, je suis le président du mouvement SAN de la société civile et je suis membre du groupe GFF. Que je remercie le GFF d'avoir nous donné un financement. On a commencé de faire un grand plaidoyer au sein du Parlement de la Mauritanie pour l'augmentation des budgets, pour vraiment impliquer le Parlement dans tout ce qui concerne la santé et la nutrition. Aujourd'hui, au niveau du Parlement mauritanien, on a créé une commission chargée de la santé, de la reproduction, la santé et la nutrition. Donc, vraiment, on a commencé un processus, mais on a besoin d'un appui de la part de nos partenaires. Ce n'est pas seulement le fonds qui manque, c'est l'accompagnement technique et l'accompagnement technique. Et je pense que ce genre des ateliers, vraiment, c'est une plateforme d'échange et vraiment d'exprimer nos besoins, parce que le besoin, ce n'est pas toujours un besoin financier, c'est un besoin technique, un besoin d'accompagnement. Une deuxième fois, je vous remercie et je remercie infiniment le traducteur de nous avoir vraiment aidé à suivre cette pertinente présentation. Merci beaucoup.
Merci beaucoup, équipe de Amami. Thank you so much for your points. I think you raise a very key issue about coordination that's going to be very important, but that also has to come from within the country, and I think that's also a point of question that needs to be posed by civil society partners in pushing for a better use of resources. I think it is also an important factor in how funding partners are able to increase investments in those issues when they see better coordination. I think that will probably come from both outlining what technical assistance is needed and what processes need to be in place. Merci beaucoup. Yes, I think the next person is Ramatoulaye. S'il vous plaît, allez-y.
Merci beaucoup. Merci beaucoup. Bonjour tout le monde. Merci Vincent pour la traduction et merci au présentateur. C'est vraiment enrichissant tout ce qu'on a entendu par rapport à la mobilisation des ressources. Je pense que je vais abonder dans le même sens que mon prédécesseur, surtout par rapport au soutien technique dont a besoin la société civile dans nos pays, parce que moi, ce qui a beaucoup plus surtout attiré mon attention, c'est par rapport à la redevabilité. Si aujourd'hui, la société civile veut suivre les engagements au niveau des budgets dans les pays, il faut que la société civile puisse comprendre d'abord comment et mobiliser les ressources, les différentes sources de financement, et puis comment sont logés les budgets au sein gouvernemental et au sein ministériel. Comprendre également aussi comment fonctionne le cycle budgétaire pour savoir à quel moment la société civile peut mener un plaidoyer, par exemple, dans le cadre de la mobilisation des ressources. Mais par rapport à la redevabilité, si vraiment il y a ce besoin de renforcement de compétences des acteurs de la société civile, qui est encore une demande dans le cadre du programme GLE, il y a eu des formations qui ont eu, mais c'était une vingtaine de personnes qu'on a pu former au niveau pays. Et vraiment, la demande, elle est là encore. C'est une demande qui est forte. Et je pense que nous pouvons toujours continuer dans ce processus, puisque avec le programme GLE, au moins les gens qui ont été formés dans la société civile ont compris maintenant certains mécanismes, comment en tout cas faire le plaidoyer, à quel moment et quels sont les acteurs clés pour pouvoir influer sur les budgets. L'autre chose qui est important aussi par rapport au pays, si je prends le cas du Sénégal, il y a ce qu'on appelle dans le cadre de l'arbitrage budgétaire par rapport à la coopération bilatérale où c'est entre gouvernements. Si je prends le cas de la Belgique ou bien des États-Unis, il y a ce qu'on appelle les coopérations bilatérales. Et ça, les budgets sont logés directement au niveau du ministère des Finances et du Budget qui va faire après l'arbitrage budgétaire. Il y a également, on est dans un processus de budget programme où il y a des budgets qui sont logés directement au niveau du ministère de la Santé. Mais il faut comprendre que quand on parle de la santé, ce n'est pas seulement le ministère de la Santé. Il y a le ministère de l'Éducation à travers ce qu'on appelle les inspections médicales des écoles. Il y a le ministère de la Défense, par exemple, le ministère de la Sécurité, tout ça à travers les gendarmeries. Il y a aussi l'hôpital principal et l'hôpital militaire de Ouakam qui est géré par le ministère des Forces armées. Et on a également au niveau du financement de la santé et de la CSU, on a deux départements qui gèrent. Il y a le ministère de la Santé, on a le développement communautaire actuellement où est logé l'agence qui gère la couverture maladie universelle. Et au Sénégal, on est en train de travailler dans une stratégie pour migrer vers la couverture sanitaire universelle. Donc, il y a tous ces aspects qu'il faut prendre en compte et que la société civile doit être très bien outillée pour pouvoir s'imprégner de tous ces aspects, pour pouvoir savoir comment, en tout cas, influer par rapport à tous ces engagements. Parce que si on veut suivre aujourd'hui un budget, il faut qu'on comprenne là où est logé le budget et comment le budget est exécuté pour pouvoir vraiment le suivre pour les questions de redevabilité. Je voulais vraiment faire cette contribution pour montrer aussi que la demande, elle est là, comment on peut toujours compter sur vous pour que vous puissiez appuyer la société civile vraiment dans le domaine technique par rapport au renforcement de compétences. Merci beaucoup.
Oh, hello.
Thank you so much, Ramatoulaye Diallo. Thank you so much from the team from Senegal for your point. That is true. It is important that we continue to build civil society capacity, and that's the basis of of this session. Our goal is to continue to work on building your capacity in the sense that we will continue to provide responses as your questions arise. But the reality is also that some of that is going to be very specific to your countries and will require better information about the context and following through on that. So it will be a process over time, I guess is the best way to describe that. I want to, in order of hands that have been raised, it will be Ekip DSCV, the Naxol team will be second, and then I'm not sure with what organization this person is, but Victor Koroma will be third. So Ekip DSCV, s'il vous plaît, allez-y.
Merci Vincent et merci tout le monde, tous les collègues qui sont là-bas. Nous vous remercions pour cette session, elle est très importante. Nous profitons de l'occasion pour que nous puissions partager l'expérience de la RDC sur le processus budgétaire chez nous. En fait, chez nous, comment nous commençons, c'est d'abord, ça commence par un séminaire d'orientation budgétaire. Donc, le ministre de budget convoque un atelier sur l'orientation budgétaire. Et au cours de cette session, nous arrivons à définir les politiques et les besoins de chaque composante, y compris la société civile. Et donc les orientations et la politique budgétaire, les priorités du gouvernement sont définies, et alors le ministre du budget prépare ce que nous appelons le cadre budgétaire à moyen terme. Et donc, le cadre budgétaire à moyen terme est élaboré et le Premier ministre maintenant prend une lettre circulaire pour orienter tous les ministères et tous les services, y compris la société civile, comment le budget va s'élaborer. Et dès que les orientations données, maintenant, chaque ministère maintenant se met ensemble, met dans son secteur pour élaborer les prévisions budgétaires. Et notamment pour chez nous, au ministère de la Santé publique, et le ministère de la Santé publique associe la société civile pour voir quels sont les besoins réels de la population, ainsi de suite, dans les cadres de priorité qui ont été définis par le gouvernement. Exemple typique pour ce qui concerne la santé chez nous, la politique actuelle pour laquelle nous sommes mis ensemble, c'est de poursuivre la mise en œuvre de la couverture santé universelle. Et là, nous avions formulé des recommandations au séminaire d'orientation budgétaire pour qu'on puisse accroître les ressources du secteur de la santé à 15%. Dès que le budget est élaboré, le gouvernement adopte le budget et il l'envoie au Parlement. Au Parlement, avant que le Parlement fasse le débat budgétaire et l'adopte, la société civile récupère le projet des lois de finances publiques. Nous analysons pour voir si les recommandations que nous avions formulées au séminaire d'orientation budgétaire ont été prises en compte. Et si ces recommandations n'ont pas été prises en compte, nous faisons des observations pour qu'on puisse le reprendre correctement en faveur de la santé de la population. Et donc, tout s'est fait à ce moment-là. OK, maintenant, nous faisons le rapport que nous allons partager au président de la République, au gouvernement et à l'Assemblée, enfin au Parlement. À ce niveau, nous faisons des discussions avec le député de la Chambre basse, qui est l'Assemblée nationale, mais également avec la Chambre haute, qui est le Sénat. Et dès que nous faisons des discussions avec eux pour faire le plaidoyer pour qu'on puisse tenir compte des besoins de la population, et si ces besoins sont intégrés, à ce moment-là, nous applaudissons. Alors à ce moment-là, le Parlement fait le débat, ils discutent et ils arrivent à voter le budget, le projet de budget. Et quand le projet de budget est voté, il part maintenant au Sénat. Le Sénat fait la même chose dès que c'est voté, et c'est à ce moment-là que le budget part à la promulgation du président de la République. Mais de là, nous avons la chance au niveau de la RDC, nous avons négocié avec le gouvernement pour obtenir la mise en place d'un réseau de plaidoyer budgétaire. C'est ce réseau qui fait le plaidoyer avec le gouvernement. Et nous avons négocié auprès du gouvernement. Le Premier ministre a pris un décret sur la gouvernance budgétaire. C'est ce qui est important pour nous ici et c'est ce que nous sommes en train de faire maintenant. D'ailleurs, on venait de terminer, ça fait une semaine, cette session d'analyse budgétaire et aujourd'hui, nous sommes en train de discuter sur le rapport que le Sénat a élaboré sur l'analyse budgétaire. Donc, nous disons que nous avons fait des avancées. Par exemple, jusque l'année dernière, le budget du secteur de la santé était de 4%. Et nous avons plaidé pour qu'en fait, cette année, qu'on atteigne 15%. Effectivement, nous en avons obtenu. Au niveau du gouvernement central, le budget est passé de 9 à 14,5%, donc avoisinant le seuil de 15% qui a été consigné dans la déclaration d'Abuja. Je crois que j'ai partagé avec vous également que nous avons contourné cette démarche pour faire ce plaidoyer au niveau des provinces. Et là, nous avons obtenu que chaque province a pris l'engagement de pouvoir accorder au secteur de la santé au moins 15%. Donc, ce sont les expériences que nous souhaiterons partager avec les collègues, ainsi qu'avec les avancées que nous avons. Ça n'a pas été facile, mais du moins, avec la ténacité de la société civile, et ainsi de suite, nous avions dans notre panel d'analyse de plaidoyer budgétaire, nous avons tous les secteurs. Tous les secteurs, nous avons 10 secteurs, nous avons le groupe qui parle des aspects globaux et tous les secteurs, en fait, l'agriculture, la santé, l'éducation, tout, nous sommes dedans. Donc, cette année, nous avons eu la chance, nous avons été honorés. Je présidais le groupe santé et c'est comme ça que nous avons d'ailleurs avancé cette année ici. Le budget qui
merci beaucoup, équipe de DSCV. Oui.
Merci. Donc, en tout cas, c'est limite là. Je crois que nous allons partager la documentation.
We unfortunately have limited time. We want to get your actual question, if there's one. Please put it in the chat box. If we can, please put your question in the chat box. I want to go to our the last two people here that we can take questions from. Our colleagues from Liberia, the team from Naxol, and then we will go to Victor Koroma. So first, Naxol team, please go ahead and ask your question.
All right, thank you very much. Again, good afternoon to everyone. The team of NASA are all seated. My name is Bentano, and I have with me Kevi Wackett and also Evelyn Visible. So thank you very much for your presentation. It's well touching, especially when it comes to the issue of the DRM, the physical space, and so on. So my question has to do with the now Liberia have just got the new elected president, and with the trend, the stages on the issue of monitoring. So where do we start from as we just got a new president? They have not given a physical space in terms of their policy. Thank you. Hello?
Sorry, we can't hear you well. Mr. Ben, can you hear us?
Yes, okay, I'm getting you.
Yes, so sorry, what was your question?
Okay, I said, now that we have just gotten an elected president in Liberia, and now the physical policy of the new elected president has not been given. If so, in terms of the monitoring the revenue trend, where do we start from as civil society?
That's a good question, and I think part of it is what we outlined here, that these different steps require looking at all the, everything from the revenue collection to the allocation to disbursement and expenditure, and it requires thinking about all these key actors, where and how you can engage them. So that's a very sort of basic starting point to help you understand the key terms and who to go to in this process, and to get an understanding of who is doing what. That, I think, helping you to get the lay of the land on who gets to decide and who gets to do what should be a starting point, and then you can start engaging them and asking them, is civil society allowed to be part of this process, and how can civil society help to support this process? So I want to go to our last questionnaire here. Mr. Victor Koroma, please go ahead with your question.
Thank you very much, Ade, for the opportunity given to us. I'm Victor Lansana Koroma from Sierra Leone, the Executive Director for Health Alert. Thank you very much for that presentation. Domestic revenue mobilization is the order of the day, especially for us in Africa. It is critical because, as we all know, the landscape of funding is draining. Donors are now trying to phase out. And so they're encouraging us to find ways, mechanisms to raise revenue at country level. But how is civil society involved in this? Most times the government, civil society is not involved in the, for instance, our government go into partnership with UNFP, sign a compact and agreement. We don't know the content of the agreements. We are not involved. And most times when you ask for this document, it is difficult sometimes for the government or even the partners to share this document with you. So how do we do this advocacy? Most times when you don't have the information, that is extremely critical. And for us, we believe this training is extremely very important. In fact, that is why we are requesting, please, that these slides be shared with us. I hope I'm appealing that they should be shared with us because they serve as a learning point for us in advocating for PFM, public financial management. So
Yes.
it is critical. So what do we do as CSO? When most times we are not on the table when these compact agreements, these co-financing deals are done. What do we do, in situations of this nature? And also in future, maybe if there's opportunity, it's also good sometimes we have this training physical. So we'll have more time to ask questions and interact with the presenters. Thank you very much.
Thank you very much, Mr. Koroma. You make a good point. Our goal is to share this, and you essentially are hitting on the key points. Not only will we share these slides, but we also provide additional resources, resource links on the broad set of resource mobilization thinking that's out there, as well as experiences to share, so that you can draw from that as best as possible. So I want to thank you all for this very lively question and answer session. And I think a lot of what we were hoping to talk about in our small discussion group has been raised here. But I think the great part of this this process, these sessions, is also in the discussion and sharing amongst different partners. So I would like to encourage us to have a small discussion group here, and to help sort of lead that discussion. I would encourage each group in the small discussion group to select one person. We're going to have two groups because of the number of people we have. In terms of logistics, we'll have a breakout room. In that breakout room, it will be for those who prefer Anglophone, that's prefer speaking and listening in English, and we will maintain in this room those who prefer French or French speaking. So that we will have two separate groups. We do this because we have a limited interpretation, live interpretation. So we would like to. That's the logistics of the different groups. So in each group, once we are separated, we will like to discuss these two questions, and that's to understand, in your relative experiences, where does the funding for your government health spending come from, and to help us to both share that experience, as well as understanding how your ministries of health, if you're aware, engages with your ministries of finance and other key ministries in the resource mobilization, public finance management process. I would encourage that each discussion group select a rapporteur who can help summarize the key discussion points. So I'm going to open up the breakout room now, and as I said, the breakout room 1 is going to be for those who prefer Anglophone, and then the others who are Francophone can stay in this main room. So we'll have breakout room 1 for those who prefer English or want to speak English, and for those who prefer French or want to speak French can remain in this main room. So I'm going to open the breakout room now. We will have 15 minutes to have this discussion along these questions I have. Please pick a rapporteur and then start your discussion. And then once we've concluded the discussion, everybody will come back together, and then we'll share our different experiences. Any questions, any concerns? Again, breakout room 1 is for those who are Anglophone or English speaking. This main room, everyone who prefers French, stay here. So all the participants, please select, all those participants who want to be in the English room, please select breakout room 1. You should see the option to go into breakout room 1. If you want to speak French or prefer listening in French, please stay here. Excellent. So I would like to kick us off as we now have people separate, and my colleagues Andrew and Eric are going to be in the other room to lead that discussion, and we'll have a rapporteur. So would anybody like to be our rapporteur for this this group? Anybody would like to be the person to help us summarize for this discussion? Excuse me, my apologies. Anyone? Okay, I will be the rapporteur for this group then. Would anyone like to share their experience? And also, in addition to your experience, please keep it short. Please keep it as short as possible. Can you please ask a key question about these discussion questions here? It would be helpful because it helps us think about how not only your experience, but how you face challenges, because that gives us opportunities to share and learn from one another. So who would like to go first? Would anyone like to go first here? Anyone have a key question or an experience that they want to share? Oui, Madame Diallo.
Alors, merci beaucoup. Pour le Sénégal, la mobilisation des ressources domestiques, c'est à travers les taxes, les redevances collectées par le ministère des Finances et du Budget. Je souligne qu'au niveau du Sénégal, c'est le ministère des Finances et du Budget qui organise ce qu'on appelle l'arbitrage budgétaire. Et c'est en fonction du contexte, c'est en fonction aussi des priorités du pays. Ce qui fait que c'est pas le ministère de la Santé peut demander, par exemple, 500 milliards pour son budget et que le ministère des Finances, dans l'arbitrage, dit que je peux vous octroyer que 300 ou 400 milliards par rapport à ce que vous avez demandé, puisqu'il y a d'autres priorités par rapport à la sécurité ou bien par rapport à d'autres phénomènes. Donc, ce qui fait que le ministère de la Santé ne fait que ce qu'on appelle la demande. C'est pourquoi dans le cycle budgétaire, il y a un moment où ce qu'on appelle le cadrage, c'est le premier trimestre, où, par exemple, la société civile peut influer sur le budget, parce que ce n'est pas au moment du vote budgétaire qu'on peut influer, parce que ça n'a aucune incidence autant pour moi par rapport au budget qui est octroyé. Ce qui fait que maintenant, s'il y a ce qu'on appelle des contraintes, il y a des lignes que le ministère des Finances ne pourra pas toucher. Mais ça, c'est pourquoi je disais tantôt, il faut que la société civile soit très bien outillée pour pouvoir comprendre tous ces rouages. Quand on fait le plaidoyer, quels sont les décideurs clés? Parce que des fois, on peut penser que c'est le ministre de la Santé, alors que ce n'est pas la personne idéale pour faire le plaidoyer ou pour l'augmentation des ressources. Donc, ce qui fait que vraiment, par rapport à l'arbitrage budgétaire, en ce qui concerne le Sénégal, on a un calendrier de janvier à décembre. Donc, c'est vraiment le ministère des Finances qui organise cet arbitrage et chaque ministère a sa part par rapport à l'enveloppe budgétaire. Donc, c'est comme ça que ça se passe au niveau du Sénégal. Parce que ici, je souligne que vraiment, il y a ce ministère qui, au sein gouvernemental qui organise cet arbitrage. Merci beaucoup.
Merci beaucoup, Madame Diallo. I will add here that you make a great point in identifying key actors and also being able to engage with them. I think this is part of both the challenge and the purpose of civil society. The work that you do is extremely important, but that means, you know, facing those resistance and insisting that civil society has a role to play. Civil society must be part of these discussions, and civil society must be able to have access and transparency to all the key actors in the process. But yes, we completely recognize these challenges. Anyone else?
Yes, from Liberia.
Yes, please go ahead.
All right, thank you very much. To address the first question, where does the funding from government have spending come from? So from our context, Liberia, it comes from the taxes our citizens pay, and also from international partners like UNICEF, USAID, USAID, GFF, and other international partners. So most interestingly is that we are very key about the SRM NCAH plus N that we usually advocate for to ensure that we have a budgetary allocation looking at the Abuja Declaration at about 15%. So the government get the inflow from different sources. Thank you.
Thank you so much, Mr. Traore. Naxal team, thank you so much for your input. You address a key piece of the transparency and civil society inclusion, in that understanding clearly where all those resources are coming from and how much is coming from those resources is going to be key starting point of actively advocating and ensuring accountability. I also want to add that this process of partners identifying the sources as a starting point also helps civil society understand, you know, when you put in so much effort to say, look, government will support you to increase your resources, will engage with Ministry of Finance, with the executive, with the legislators. It's important to also see how much of your work is actually successful, because that helps you understand which of your strategies are working. So if you are partnering with these different ministries to increase resource investment and resource pooling or resource baskets, it's important that you also have access to it, because you are essentially a key partner in generating, in supporting the generation of those resources. So definitely, I think as a strategy, it's important to stay those key actors in order to be able to get greater access. Is there anyone else? We have about 5 more minutes left. Anyone else who wants to talk about anything related to DRM? Maybe not these specific questions, but some key question that you have about your experience, or tell us something important that you learned in your engagement of DRM in your country. Please keep it as brief as possible, because that will help us and try and learn as much as possible.
Hello.
Yes.
Hello.
Yes, please go ahead.
Hassan from Sierra Leone is my name. I'm very, very, delighted and very, helpful to be part of the discussion on DRM. For us in Sierra Leone, we are very, very critical in the resource mobilization strategy and mobilization drive that we do as a local, civil society in Sierra Leone. Of course, Health Alert, we've engaged a lot of activities on resource mobilization, which has to do with public financial management. That is, in essence, we raise awareness on public spending. How prudent are DBOCs, the finance officers at local level, can see the relevance of domestic resource mobilization. at district and national level. So, for instance, in 2021, our government of Sierra Leone signed the Abuja Declaration to increase health budget by 15%. As we speak, we are at around 10 to 11% of that 15%. So there is still a challenge to scale up without drive. So in the health engagement with Minister of Health to at least prioritize their revenue resources. So we have done some critical engagement by designing position papers at the just concluded budget hearing that we just held in Sierra Leone, that at least government should prioritize Minister of Health budget due to the fact that it's very critical. As we speak, there is still a last mile distribution challenge. For example, we engaged the local council for them to raise resources so that they can address this stockout issues on FP at last mile distribution. For example, government has challenges with procurement and distribution of FP commodity at last mile distribution. So for us to address those issues, we engage local councils so that they can raise their internal revenue so that they can address those issues on transportation, because the issue has been around there is no transport for us to transport those commodities from the central government to the sub-national level so that they can address those issues. So in a very summary stage, of course, we have a high level of teenage pregnancy. So the challenges are very enormous on the health sector. So we need to at least to speed up so that more revenue will be, coming for the Ministry of Health so that they can address these challenges for us to address the issue of so that we can achieve this universal health coverage. That health should be a kind of a citizen health services should be okay, not free, but at least should not be burden on the poor. So out of pocket spending should not affect the citizen. So we are advocating for that, drive so that we can address this issue of out of pocket spending, last mile distribution spending, teenage pregnancy is also an issue, and commodity on procurement is also an issue. So as we speak, we are still at 10 to 11% on that Abuja Declaration. So we are very, very in that drive to push up so that government can scale up to address those, emerging issues. Hassan is my name from Sierra Leone.
Thank you so much, Hassan. Really appreciate your feedback. I think that you point to an issue that we sort of alluded to in this discussion, that is that any domestic resource mobilization strategy should be aligned or coordinated with government overall strategies for health financing. In this case, you are moving towards universal health coverage, which is creating a funding basket so that people do not, particularly people who face challenges with paying, don't have to pay out of pocket. But that also has to be coordinated with your focus on SRMNCH, which is focused on teenage pregnancy prevention, which is focused on child health and on all these other things. So yes, we completely appreciate your outlining that particular area. Unfortunately, we are now at time for our breakout room to end. I want to say thank you all to all the partners for your feedback, for engaging, and we want to be able to. I'm going to as we continue to the next, as the others join us now, we are going to try and I'll try to summarize your points. But again, this is not going to be just at the end of it all. We will share the slides. We will continue the conversation. We'll encourage active engagement across different partners to ensure that you are able to share your experiences where there's great benefit in understanding how others are experiencing this. This is, I think, the richness of this collaboration. It brings together multiple people from different countries who are within great coalitions where we can learn from one another as we face these challenges and successes together, and so we can learn from our different contexts. So I think our colleagues are going to join us shortly, and then we can have them all report back to us. I want to thank our colleagues who have rejoined the session. And as a way of sort of helping us to wrap up as we move along, I want to thank you all for your rich discussion, your experience, your telling us about your context. That really helps us to understand the key elements of this. And so before wrapping everything up, I want to hand over to my colleague Andrew, who was in the breakout room, or to the rapporteur that was selected for breakout room 1, who can tell us, quickly summarize what they discussed, and then I will serve as the rapporteur for the main room. Over to you.
Thank you, B. So in our breakout room, we heard from a couple of people talking about how the ceiling for the health budget is set by the Ministry of Finance or Ministry of Finance Budget and Planning, and that is then given to the Ministry of Health for them to work to determine the priorities, like, often going to the district level and building up, and then any gaps that exist are being filled by international partners. Many people talked about the sources of funding being taxes or development partner grants. And something that was mentioned is that, like in Zambia, for example, the Ministry of Finance will create its budget, and then like Parliament will be consulted, but it often happens very late in the game. And so it seems like there aren't as many interactions early on with like the Ministry of Health, like contributing to the development of the ceiling. They're kind of given it and then have to work within it.
Thank you so much, Andrew. That's really important. Thank you for that feedback, and my thanks to breakout room 1 participants for that informative discussion. From our side, in the main room, we are colleagues from Senegal, Liberia, and Sierra Leone brought very important points around, one, the challenges of identifying the resource pool or the resource streams, and the key actors that not only affect that resource stream but decide on how those resources are used. And a colleague also addressed the issue of entry points for civil society in engaging and being part of the decision-making process. We discussed how using just the elements of these slides and the questions and identifying the key actors would be a helpful starting point. And lastly, there was discussion on coordinating from our colleague from Hassan from Sierra Leone. There was a discussion on ensuring that that this domestic resource mobilization is aligned with other country objectives like universal coverage, and quite a few people brought up the Abuja Declaration, where countries committed to spending at least 15% of health expenditure by the government. So all these key initiatives on spending are aligned both with the DRM strategy, UHC, Abuja Declaration, and your co-financing agreements, ensuring that there's alignment between all those key areas. And I think this, I go back to the basis of this presentation, this session. The entire conversation around DRM could be 1 week of training of sessions, and would have a very rich and in-depth process. Unfortunately, we don't have that time. This is meant to be a very basic foundational understanding to spur the discussion and to provide you with the context to be able to think about these areas and where they align with your civil society organizations' objectives. Once we're done with the session, we will share not only these slides, but a number of other resource links to DRM and PFM papers and experiences and reports, so that you can not only get a broader sense of these key concepts, but understand, from different country case studies, experiences, how they can inform your strategy and inform your objectives. So, we want to build on this experience, not only by sharing this information, but also to start thinking about different ways to reach out. So we will, in addition to sharing the slides, we'll also provide a link or an email where you can ask your questions around health financing, whether it's investment case or DRM or other aspects of health financing as it relates to the work that you're doing in your respective countries. We're really grateful for your participation today. The partners are the ones that make this GFF CSO engagement rich. They're the ones that contribute to making this process helpful and equally important towards ensuring that people actually get the care that they need, particularly for sexual, reproductive, maternal, neonatal, child, adolescent health and nutrition. So I want to thank you all for your contributions, for your time. We know people are coming from late in the day, evening, at night. People are coming from different activities, and they've prioritized this. So this is really important to us all. Thank you so much for your feedback. Thank you for your discussions. The last thing that I always ask in these sessions, and that I hope that will be a good thing to see, is for us to now share our videos so that we can see who's joined and be able to thank you all and take a picture. If you are willing to participate in this, take a picture so that we can and just show who all the people who have been in this session. So I'm going to start by sharing my video, so you can see me. Please share your video so we can see your faces. We want to thank you all. If you're willing to, it's not a requirement, but this is just to encourage everyone to share a picture. Hello, how are you all? Good afternoon. Folks are even joining from while they're driving. And so we thank you all for your participation. We're really grateful for this opportunity. I see people from a wide range of places. So thank you all so much for participating. This is really, really helpful. Thank you so much for contributing. Thank you for your questions. We will do our very best to continue this conversation and encourage you all to continue to send in your questions, send in your experiences, give us an opportunity to continue to build this conversation as it goes along. So thank you all so much for your participation. I'm going to say, let you all go back to your, we have somebody who brought their kid there. So hello, thank you for joining. I hope you learned more about health financing and
Yes,
domestic
I
resource
did. Thank
mobilization.
you. I did.
Thank you
It's
so
10
much.
o'clock in 10 p.m. in Vietnam, so I have no other choice. But it was a very informative session. I learned a lot. Thank you very much for the opportunity.
Thank you so much. Thank you, everyone. I'm going to let you go so people can go to bed. People can get the rest of their day done and get to all their other priorities. But thank you so much for your participation, and we will be sure to follow up. Thank you, and have a good rest of your day and or evening. Thank you so much.
Thank you.
Thank you.
Thank you, everybody.
Thank
Bye.
Merci.
Thank you, everyone.
Merci tout le monde. Bye.